Okay, so just a little, I'm going to provide a little bit of background today, including how the health belief model can be used to look at vaccine decision-making, vaccine acceptance and inquisitiveness, and overall vaccine decision-making. Oh, should say health belief models and vaccines. So the health belief model is a health behavior theory or framework that looks at how people make decisions about their health. And in terms of vaccines, so modifying factors are individual characteristics, such as ethnicity, education level, income, that then impact your individual beliefs. So in the case of COVID-19 or influenza, it's looking at your perceived susceptibility or severity of contracting the disease, and perceived benefits or barriers to preventative action, which in this case is vaccination. So all of those factors then lead into the individual behavior, which is whether or not to receive a vaccination. A lot of people tend to view vaccine decision-making as two sides of a coin. People either accept it or they refuse it. And I think we need to reframe the conversation a little bit more to look at it as vaccine acceptance and inquisitiveness. It's much more of a spectrum of beliefs. So on one side here in the green, we have individuals who accept all vaccines with confidence. They trust and have faith in the systems. On the other end, we have individuals who refuse all vaccines with conviction or confidence. And then in the middle there, where a lot of people would say that these are hesitant individuals, I want to put in that they are inquisitive. They have questions and concerns. They want more information. And it's not necessarily saying that they will not receive it. But as you can see, there's a whole range of decisions that can be made within that. So as we saw in the health belief model, in that first column of modifying factors, there are a number of different influences in our environment and socially that impact how we make vaccine decisions. So one of the biggest factors that has been observed in influenza vaccination rates, as well as significantly in COVID-19 vaccinations, are decisions by race. So you see here in this chart from the CDC, looking at flu vaccination rates in adults according to race and ethnicity. So on the yellow bar across two different flu seasons, we see that the highest rate of acceptance is among white non-Hispanic adults. This has held very true for COVID-19 vaccinations as well. And then in the orange bar, again, the lowest across both seasons are Hispanic adults, which again, among influenza and COVID-19, we have much lower vaccination rates among people of color and minority groups. And then also differences by rurality. So individuals who live in urban areas versus rural areas across the United States have different vaccination rates. This has been seen a little bit more predominantly in COVID-19, and that difference, the gap between urban and rural residents has evened out a little bit, but residents of rural areas have faced higher cases, higher mortality rates, and lower vaccination rates throughout the COVID-19 pandemic. Okay, so for this study, I conducted a mixed methods approach. For the quantitative portion, I asked, are individuals who received a COVID-19 vaccine more likely to receive a flu shot in a typical year? And for the qualitative portion, I inquired, how do individuals make decisions about flu vaccines? So the data for the quantitative portion was pulled from the Kittitas County Public Health Department's COVID-19 Vaccine Attitudes and Beliefs Survey, which was conducted in September and October of 2021. And I performed a chi-square test to compare COVID-19 vaccination to receipt of a flu shot in a typical year. And then for the qualitative portion, I conducted 11 one-on-one interviews My overall thesis study is looking at parental status as a modifying factor in COVID-19 vaccination status. So that just happened to be the population I worked with. These people were recruited from the overall quantitative survey as people who expressed interest in a follow-up interview. Okay, I realize these are tiny numbers. I apologize. So the demographics for the quantitative portion, just a couple things I wanted to point out. There are 581 participants included in this analysis. It is across both groups of, on the left, typically receives a flu shot versus typically does not receive a flu shot. Among both groups were predominantly female, about 3/4. Pretty even distribution across age ranges between the two groups, and slightly overrepresented in white participants. But the biggest things I wanted to note were have you received a COVID-19 vaccine? So we're going to go more into this on the next slide, but I think it's striking that 94% of those who say they typically receive a flu shot have received a COVID-19 vaccine. Even more striking is that it's a 50-50 split on those who don't receive a flu shot have not received or have received a COVID-19 vaccine. Okay, so here are the results of the chi-square test. So the question on the survey was, in a typical year, do you receive a flu shot compared to have you received a COVID-19 vaccine? The p-value implies that, yes, there is a very strong significance between these two variables. And I think it's demonstrated a little bit more visually in this. So looking at the percentage of the survey respondents of these 581 participants. So 60% of them overall received a COVID-19 vaccine and typically receive a flu vaccine. And then again, that 50-50 split of individuals who do not receive a flu vaccine, half have received a COVID-19 vaccine and half have not. Okay, and the only thing I wanted to note on the demographics for the qualitative participants is that while all 11 have received a COVID-19 vaccine, thank you, only 8 have a consistent flu shot. Okay, I'm going to read one quote really quickly. These are pseudonyms. So Rose, a mother of 2 young children, said, I certainly as a young adult did not get flu vaccines. I really thought I was, protected from it. So ridiculous. Like such a young person thing to think. And I didn't see the systemic reason for getting it. Once I started getting those flu vaccines before I was a parent, but definitely that has reinforced my need for it. I just see it as so important now. Kind of emphasizing what I've seen throughout this study is that individuals are not getting the flu vaccine or COVID-19 vaccine just as a protection for themselves, but also for the protection of those around them. Okay, so the majority of interviewees expressed a higher perceived benefits through confidence in vaccines and trust of healthcare providers, and lower perceived severity and susceptibility to influenza than they did for COVID-19 vaccine or COVID-19. Okay, so really briefly, people who received a COVID-19 vaccine are significantly more likely to have received a flu shot. And again, the 50-50 split in individuals who do not receive a flu shot typically. Brief limitations, since my variables are categorical, I only have a handful of tests to test for significance. And for the qualitative portion, it is a small sample size with fewer questions about influenza than COVID-19. And then implications. We need more research on why there's a split. Why did only half of the people who typically don't receive a flu shot get a COVID-19? What prompted them? Did they have a higher sense, a higher perceived severity or susceptibility, or did they have more perceived barriers to the vaccine? We need more outreach and education on overall vaccine safety and efficacy for influenza, COVID, routine pediatric vaccinations. And in line with vaccine inquisitive individuals, we need to create more opportunities for people to ask questions of trusted healthcare providers and trusted sources of information to help build confidence. Any questions? Thank you.
Were there any data that you had access to in this to identify access issues, healthcare access issues?
Yes, the overall survey did ask questions about if you have not received a COVID-19 vaccine, do you have the information you need in order to seek it out? The phrasing of it did not yield the results we were hoping for, and a lot of people just angrily replied, I will never get the vaccine, or thinking that we were trying to poke them further. So we did ask, but we didn't quite get what we were looking for with that.
Hi, MacKenzie. Great job, and thank you so much for your presentation. I'm curious if you can talk a little bit about prior literature on vaccine decision-making, and if influenza vaccine typically, as you investigated here, is predictive of other types of vaccine decisions. Are your results consistent with prior literature?
So yes, one of the top indicators for people to receive a flu vaccine is if they've received it in the past. So that repeated confidence. The rest of your question was about just, yeah. So it's tracked with prior literature, and especially one of the studies on influenza vaccine uptake. For parents of children, talking about how the more education they had, the more likely they were to get their child and themselves vaccinated. So it's, again, increasing the perceived benefits and decreasing those perceived barriers. So yeah, it's been consistent with previous literature. Thank you. Thank you.